Welcome, and thank you everyone for joining us for this first episode of our Family Caregiver Webinar series. Having a backup plan in place. What if you get sick? This is a really important topic, and I'm grateful to our presenters, Jennifer Merrilees and Nhật Bùi, for being with us today.
Great, thank you. Thank you to everyone who's joining this webinar today. And we want to first acknowledge that we're all living in unprecedented times right now. And the staff here at the UCSF Memory and Aging Center developed this series in the hopes that we can help address relevant questions and talk about strategies that may be helpful in the coming days and weeks. So our goal today is to provide some information and some details. We really welcome your questions that you can type in and your comments, and we're hoping that the questions and comments really help us all to learn. So please think about sharing what's working, what's not. We're going to have a lot of links to resources in this talk. Please don't worry about trying to write them down. This talk will be available on our website along with a couple other documents that we're going to refer to. So everything will be on our website for you. So let's first do a couple of introductions. My name is Jennifer Merrilees. I'm a clinical nurse specialist here at the UCSF Memory and Aging Center. My work focuses a lot on family caregiving.
Hi everyone, my name is Nhật Bùi. I'm a nurse practitioner and I'm both working in the Memory and Aging Center on the research side as well as seeing patients over at our clinic.
Great, so let's first define what we mean by a backup plan. A backup plan is a way for you to feel prepared in meeting the needs of your loved one in the event that you can't fulfill those needs. We thought that there is a real possibility that our family caregivers could become ill. Hopefully, if they do, it's mild. But even mild illness can hamper someone's abilities to care for your loved one and may interfere with your ability to be a caregiver. Ideally, you'll never need a backup plan, yet having one could potentially offer you peace of mind in knowing that things are as organized as you could possibly make them right now. And also, I think a lot of people we've heard and we've experienced ourselves by sheltering in place that we have a little bit more time on our hands perhaps, and so this could be viewed also as sort of a structured and important task to do while you are sheltering in place. Now, the most important issues to consider in making a backup plan or reviewing the backup plan if you already have one are thinking about who could help you provide caregiving and what is needed to make for a smooth transition in care. So the first thing you might want to do is just think about the people and the resources that you rely on for support. We've listed some examples here. We often think about family members, friends, neighbors, clergy, even a member of your support group that you've gotten close to. And the kind of support that you get from these people or resources can mean everything from emotional connection, could be advice, problem solving, to actual hands-on care. So maybe somebody who's helping you with providing meals or running errands for you. As part of what we've already experienced with the COVID-19 virus is that you may have lost some of the help of your hired caregiver. We've had families that have told us that the day programs have really reduced attendance. So you may have already experienced a change in the kind of support that you've been relying on up to this point. The next thing to think about is make a list of who you could call on for an assistance. And again, this could be family, friends, neighbors, people that you've made this arrangement with. And it is important to make sure that anybody that's on your list of providing you help and providing backup know that they're on your list and that you both are in agreement and understand just what type of backup can be provided. So make sure that people know and that you all agree on how somebody can help. And think about maybe some of the decisions that you might have to make ahead of time. So if you have a backup caregiver, would they come to your home and assume care of your loved one, or would your loved one go to their home? So those are some of the details you want to think about. And then you can also consider some of the community resources that perhaps you can rely on. And I think a lot of community resources are still up and running. They may be limited in what they're doing. In some ways, I think some of these community resources are doing more than than they ever did. And these are just some examples. So you might think about seeing if you could get a volunteer to help you. You might look into your local Caregiver Resource Center. Again, these are in California, and we've given you the link, and you'll have the link after the talk. The Caregiver Resource Centers are organized by county, so you just look up which county you are, and it'll give you the contact information. You might think of trying to get paid help from a home care aide through an agency, or even have your loved one moved to a memory care facility. And the Alzheimer's Association sponsors this community resource finder so that you can look for these sorts of resources in your own area. And again, these agencies, memory care facilities, may have very different policies about whether they're accepting people now and what kind of staffing they can provide. So it's probably best just to check with individual agencies and find out what their abilities are at this point. We also thought it was important to emphasize that it's good to stay in touch with your primary health care provider. And, you know, we're kind of focusing this talk on your loved one, but it's also good for you to stay in touch with your own healthcare provider. We have heard from people that there can be some delays in reaching your doctor, so connecting early is important, especially if you have unique concerns. So we've had caregivers that have chronic conditions themselves, and so it's really important to keep in touch with your doctor so that your doctor can know what your plan is, what your issues are, and what you're concerned about, and they can help be part of the problem solving and creating the backup plan with you. And it's good to know if you think you might need to be screened for the virus, to really know what the protocols are in place for that type of screening. And then let's turn a little bit now to talking about what sorts of things you want to have on hand that pertain to the person you care for. Again, thinking about what are the components to your backup plan. And these include things like copies of your health insurance card, having a list of the person's current medical conditions, up-to-date list of their medications, any allergies that they have. Write down the contact information and name for the key people that are involved in your loved one's care. So again, the doctors, family members, friends, or neighbors. And then if you have healthcare directives, advanced directives, the documents that spell out the person's wishes for end-of-life care and the type of decision-making they want around their medical care, have a copy of that handy too. And we're going to talk a little bit more about advanced care directives in just a minute. So we'll go into more detail about that. And then we also think it's important to get all this stuff together and kind of keep it together and put it in a place that's sort of visible and accessible to you. And then I'm going to turn the next set of slides over to Nat.
Yeah. So can everyone hear me? Everything's okay? Okay, so another helpful document to have is what we recommend, a care plan. So a care plan allows you to write down important aspects of care. So for example, how the person you're caring for communicates their needs, how do they normally express their emotions, what a typical day is like for them. So what time do they get up in the morning, how do they prefer their morning care, when do they prefer their meals, what type of activities do they like and enjoy, typically when do they go to sleep, and any other tips that you have for successful care. So while we don't specifically need this type of form, you can write things down on a plain piece of paper. It might be easier for you to use your own template. And we also have a template as well. So this is an example of one that we developed in our care ecosystem program. It is about 5 pages where you fill in the important details, things that make your loved one happy, things that are upsetting to them, ways that they show pain or distress. And this form will be available on our Memory and Aging Center website along with this webinar. So now let's talk about some items that are good to have organized and ready to go. So we recommend having several days supply of medications. Some experts have said that, they recommend 90-day supply. Definitely reaching out to your loved one's care providers and your provider to have enough medications for both of you. We recommend some changes of clothing and some essential toiletries. We recommend any needed supplies such as incontinence briefs, wipes, excuse me, any hearing aids or dentures, any backup glasses, anything that are essential for you to kind of go on with your day. We also recommend having some comforting objects, things that they like to have or use regularly, and activities that you like to play or to do, and like a music player and some earphones. Any preferred snacks that you can have on hand. And then just a note on the outside of the emergency bag or container to remind you to include a cell phone and a charger. So we mentioned advanced directives earlier, so I wanted to spend some more time on this. So advanced care directive is a way to document important decisions and your values about your loved one's care and their values about their own personal care. And so if you have one, definitely find it, review it with between you, and even update your healthcare providers. It's okay if you can't sign one now or have it witnessed now, but reading through it and discussing it, and having some form of plan in place can still be helpful. So we recommend going to the Conversation Project, and it goes through ways of having this discussion and what are some things that you should be keeping in mind, and to discuss what types of preferences for care that you would like. We recommend sharing your notes by scanning or faxing and emailing them, or sending a picture of it to the people that you trust, as well as your healthcare provider. And there are other resources that have also updated for the COVID-19 situation, such as Prepare for Your Care, and you can go to the form there. There's also areas on aging, as well as consumer advocates for nursing home reform. So these legal resources are still considered essential, and many of them are working remotely to help people complete legal documents. And so definitely reach out to them if you do have the need to complete these forms. So I think a lot of us are definitely thinking about what happens if you as a caregiver get sick. So if your symptoms are mild and you can stay home, I think that's preferable. I think other ways of managing this is to kind of alter your expectations for your loved one's care. So if it's too difficult to maintain a daily routine, the important thing right now is to ensure safety in your home. So if the person you're caring for is at risk for wandering, make sure the doors are locked. Definitely keep a current photo or picture of them in case there is a risk for wandering. We recommend enrolling them in the Safe Return program through the Alzheimer's Association. And if your loved one is unsafe in the kitchen or other areas in the house, definitely disable the appliances or keep anything that could be used as a weapon or that could be harmful away from them. Definitely put activities in place and a routine that require the least amount of effort. So, if your loved one may not get bathed or even get out their PJs, that's okay. And if they may be watching more TV along with you than before, that's okay too. We have heard of people using the remote control Amazon Fire TV with a smart app that you can control. And so these can put on, TV shows and music programs or movies that they can enjoy. Great. So if your symptoms are more severe and you need emergency care, this is the time to kind of activate your backup plan. And so definitely reach out to your backup person to assume care of your loved one with your instructions, and then call or notify your healthcare provider first, and as well as your loved one's healthcare provider. I would definitely call before you go in. You can call 911 as well and go to the emergency room. If you do need to go to the hospital or emergency room and there's no one to care for your loved one, we recommend that you can still bring them with you and just explain that you are their caregiver. So here are some resources for staying connected. We have the Alzheimer's Association 24/7 Helpline and other California resources. The COVIA online and phone support activities. We have the Institute on Aging 24-hour friendship line that you can call in case you need help. And please don't hesitate to reach out and connect with others. These are just a few suggestions, and hopefully as we go into our Q&A and our talk with each other, other people can share other resources they have found helpful. And so resources for staying informed on the COVID situation, we highly recommend the CDC, or Centers for Disease Control website. They have up-to-date information, and as well as refer to your local website, local Department of Health and Human Services, depending on your county, what their instructions are. There's also the U.S. Department of Health and Human Services website. We are trying to keep our Memory and Aging Center website up to date, along with this webinar and any other documents and resources that we have for you during this time.
Great, and I'll just mention too that subsequent webinars in this series, we're planning on going into more detail. You could probably tell by the title on the flyers. We're going to go into more details about ways to obtain supplies, how to access resources, suggestions for activities that you can do while you're at home, sheltering in place. And also sort of how to protect your own health as a caregiver, protect your own health and well-being. So we'll go into some of those details more in other webinars as well. But maybe what we can do now is take any questions that people have submitted around this idea of having a backup plan.
Thank you for that presentation. And I encourage our participants to actually type in their questions in the Q&A box on the bottom of their screen. And I'll start off with a question. I'm curious what your thoughts are for those who have family members who don't live in the same state, or who have kind of thought of their backup people as, their loved ones who live out of state or across the country. What are your thoughts for them in terms of their backup plan if those loved ones may not be able to, mobilize and be there during this crisis?
Yeah, I think it's a great question. And I think it's actually a question a lot of us are sort of thinking about in our own personal lives as well. And I guess my first thought might be to think more broadly about people that are in your area that wouldn't have to travel, that might be able to be part of your backup plan, and exactly what they might be able to help with. I think this experience and the situation that we're all in is really forcing us to maybe think a little bit more broadly and about what we'd expect and what we could do. So I think maybe think about whether if family can't do it because they live too far away, are there friends or neighbors that live locally that might be able to help? Is there a way to get a volunteer to help, or to hire some help from a local agency, even though it wouldn't be your ideal backup plan. Your ideal backup plan would, of course, to have a family member help. But if they can't, maybe there's another tier of support that you could be thinking about.
Mm-hmm. And I'm wondering, I guess my other question is around adult protective services, and if there's any way that they might be also a resource, or we're not as much in this kind of a scenario, if you have any thoughts on that.
I think I'll just answer, and then Nat, I'd love to hear your answer too. I think we've heard anecdotally that we have caregivers that have reached out to their county adult protective services out of a concern that they're not able to adequately provide care for their loved one. And I think it is a resource that you could think about if you think that things are really unsafe with your current situation. And I think in sort of more normal times, adult protective services, I think, has been really helpful for families in identifying community resources and helping them think about ways to make the situation safer and easier to deal with. So I would think that would still be definitely an option.
Yeah, I agree. I think, APS falls in line with kind of emergency services, and especially if you are feeling like there is no one that can help you, and if you feel like you need to be hospitalized and your loved one can't be hospitalized and there's no one around to help you or to care for that person, then obviously APS might be the only resource to monitor the situation and kind of give you resources and provide support for you during that time. Yeah, so again, it's not probably ideally the first step that you would take, but definitely have that in your toolkit, in your box of resources would be great.
As a last resort.
As a last
Thank you.
resort. Mm-hmm.
Yeah.
And I guess too, if things really feel like they're unsafe, I think we don't want people kind of suffering or staying in unsafe situations in the home. So even reaching out to local law enforcement if that seems appropriate, or reaching out to Adult Protective Services and talking to a social worker there. We just really don't want people to feel like that they're sort of forced to be in a situation that they judge to be unsafe.
We had a question that was emailed earlier around the caregiver is concerned her husband has Alzheimer's and she herself has asthma, and it's obviously a risk for being more susceptible to the COVID-19. So she's wondering, I put a lot of things in place. They have caregivers coming in the house. She has them wearing masks and washing their hands and cleaning surfaces. Wondering if you guys have any other recommendations on what she can do to protect her health and be prepared.
Yeah, I think that she's done a lot of great steps already, especially being able to still continue to have caregivers come into the home, but taking the appropriate precautions with gloves and masks and sanitizing and washing your hands. I think at this point, the CDC recommends all those things as the first line for prevention of contacting this disease. Just making sure, again, having all your medications available, having enough supply for you and your loved ones. And if anyone should feel sick, especially the caregivers, please tell them that they should not be coming in. And that if you start feeling sick, as well as taking the appropriate precautions for you too.
I would add to that too, just as we said in one of the slides, I think early contact for the caregiver with her own primary care provider, or if she has a respiratory specialist, to really be in close contact with them so that they can help her kind of monitor how her condition is, and sort of have a plan of what she would do if she felt like her asthma was worsening, or if she was possibly getting sick, I think would be really important. And I will say too that a lot of the clinics, our own clinic, have really switched over to phone and telehealth appointments. So I think what we've heard is that some people have delays in reaching their providers, but most providers are still in business and maybe switching over to talking to you on the phone, talking to you over video conferencing like we're doing today. So not ideal. Everybody would much prefer to be in person to do this kind of work, but there are ways to be in touch and to stay in touch with your provider. It just may take a little bit longer. So I think starting early and making that contact early would be really important.
Thank you. There were a couple of questions typed in the Q&A, and again, I encourage our participants to add their questions to the Q&A box below. These both questions are asking for input on, how to address mood symptoms. So their loved ones are isolated. I think everyone is kind of more on edge, so they're dealing with just mental health suffering, maybe more anger and aggression, being stuck inside all day. I know this is the topic of future webinars, but I wonder if you just have any thoughts to add to that, since there are a couple questions.
Yeah, I can go first if that's okay. I think this is a time for people to feel a lot of anxiety, and I think other emotions that we're hearing that people are experiencing, we're experiencing ourselves, is anxiety, worry, even anger, frustration. And I think for our patients, a lot of times this is because their routine is probably really shifted, that none of us are used to being at home for this extended time. And so routines have been disrupted. We know those disrupted routines are really hard on our patients with dementia, who really prefer sort of a familiar, structured day. And I think too, we're all trying to stay informed. It's possible that the news is on a lot. The news is not very uplifting right now. So one suggestion I might make is just to think about, do you have the news on a lot? Should you maybe cut that down, maybe limit exposure to the news, put on music or a nice movie instead, which might help. And we think in a lot of these illnesses, the emotions are fairly contagious, and so if you as the caregiver are feeling anxious or mad or worried, the message to your loved one is probably that there's a reason to be anxious and worried and mad. And so not to put all of this on the caregiver, but I think a lot of times their cues about emotions come from the people around them. So I might just look at the environment and see, is there a way to sort of change the way the environment feels for that person and for you, to maybe improve things a little bit.
Yeah, and I just wanted to add, we are sheltered in place and we are stuck at home now or wherever we're living. And that requires kind of thinking outside the box in terms of looking at what type of activities that we can do inside the home. And I think our future webinars will give a lot of input and recommendations for those. I think just on a general level, just thinking about what are some things that your family members or your loved ones enjoy in terms of watching or listening, and how to replicate that in the home to kind of improve the mood. Mm-hmm.
And I guess too, it goes back to sort of looking at, can you identify if is there a pattern
Mm-hmm.
to the mood changes? Is there like a triggering event? Does it come at the end of the day? Does it come, is it associated with specific things? And are those things that maybe you could change somewhat to help with some of these mood issues? But I think we and all the staff at the Memory and Aging Center, this is one of the things that we've really worried about a lot, is that when you're home and cut off from your normal resources, just how is everybody's mood doing, and how are people handling all of this? So again, with your loved one that you're taking care of, it's possible that you might see patterns or triggers, and that might give you a clue of maybe how to change their environment or their day a little bit to help minimize some of this mood disruption.
Yeah, one question specifically is asking, I'm not able to take my mom out to enjoy the sunshine. And I wonder if there are some thoughts about, all these things that we took for granted, a month ago, that we, the opportunities are so limited now. And I think people have different risks in this area. If you live in a single family home, maybe it's easier for you to get out in the yard or on the porch. But if you live in an apartment and you have to take a shared elevator, maybe, there's more risk involved. So any thoughts on how to kind of minimize your risk for still getting some sunshine?
I still think that they are recommending that exercise is still an essential activity that they can go out for to get. I think the precautions is just to stay 6 feet away from someone, and to make sure that no one is coughing or sneezing, around you. So if that means having to wear a mask down the elevator before going outside, and then taking off the mask to kind of enjoy the fresh air and the sunshine, that's one way of doing it. Because exercise is really essential for our mood as well. And so 5 to 10 minutes could really help. And, our weather is unfortunately getting better nowadays. So it would be nice to enjoy some time of it outside.
I was going to suggest too that if you have a car, maybe it's possible to get out and go for a car ride, and kind of get out of the neighborhood or out of your house or out of your apartment building and enjoy that activity. That's not been restricted. You can't go to the county parks any longer, but there are still places that you could go that maybe you could, and maybe just the act of driving somewhere would be like a really nice diversion for the two of you if you're able to do that. And I agree, and we'll share these in some other webinars, but there are a lot of different online exercise programs going on now, yoga, chair aerobics, Tai Chi, things like that. So if going out during the day is about getting sunlight. And if it's also been about going for a walk and getting some exercise, maybe there's a way to substitute, that need for exercise with something that you can do indoors. I think probably we go out for walks and we get outside in the sun, and we do that for lots of different reasons. So thinking of how can you meet all those reasons while sheltering in place might be helpful.
And here's a caregiver asking, my husband doesn't remember to social distance when walking. Any suggestions? So it sounds like maybe the car ride would be an option. That's not going to be as active. So any other ideas?
Yeah, that's a good one. I know I've heard that from a few different caregivers about their loved ones not really appreciating the risks. I think thinking about, could you go out during the time of day when there's less public out? I've noticed personally that around 4 or 5 o'clock in the afternoon is when a lot of families come out and go for walks together. So maybe thinking about, is it possible to get out earlier in the morning? Or just sort of watch the patterns in your own neighborhood, and are there times when there's less people out might be better, or just take different paths that may be less frequented by other people, and again, to keep your loved ones sort of away from the public. And I don't know whether I'd love to hear from caregivers about this, but I don't know whether the symbols of people wearing gloves and wearing masks is sort of a visual cue to our patients that there is something a little bit different. And so if they wear a mask, or if you have a mask and gloves on and they see other people in public wearing the same things, that's you're kind of reinforcing, those are clues that are kind of reinforcing the need for social distancing right now.
And there was just a comment that grocery stores are only allowing seniors to enter at specific times. And I don't know if that's a regulation or if that's more of a window where it might be safer because there's fewer people in grocery stores at that time. But yeah, I guess if you have to take if it's not safe to leave your loved one at home and you are taking them to the grocery store, the social distancing might look into getting your groceries delivered or drive-by pickup.
Getting them delivered or pickup, my understanding of this, they call them, so I guess the senior hours at grocery stores, is to give seniors a chance to be able to shop without being exposed to the rest of the public. So it's not that they have to go and shop during like that 1 hour period in the morning, but it's a chance for them to be able to shop without being exposed to other members of the public. And again, thinking of a backup plan, it might be really good for you as the caregiver to get out and do that shopping. It might be something, as long as you're doing it safely, it might be nice for you to do. And if your loved one can't stay home alone, is this a chance to maybe ask a neighbor to keep an eye out for the person while you're gone? So, or volunteer or something. Is it possible to bring other people into your sort of experience, your caregiving experience, to get the help that maybe you need during this time?
Yeah, I do know that I think Costco and Target and like Trader Joe's, I think a couple of the grocery stores have designated an hour at the beginning of their day that's only for seniors. So I would call in just to check if that is applicable to their stores.
And what about people who might be feeling like, I did want to actually ask for people who are living with someone who's becoming more aggressive. At what point would you recommend calling, and who would you call, I guess, for more help if it's starting to feel unsafe in the home when someone's getting aggressive?
I would look and see if you can identify the triggers that are creating that. And if you can reverse some of those triggers or modify some of those triggers, can you sort of minimize and modify the aggression? I would stay in touch with your person's healthcare provider to help them sort of problem solve what might be triggering the aggression and what might be like an appropriate way to manage it, whether changing medications or starting a medication might be appropriate or not. I guess just, again, thinking about the triggers, look at the environment and are there things that are, you think, sort of triggering that? Are there things that are sort of influencing the person's aggression and agitation? I don't know, Nat, do you have other?
Yeah, I mean, like you said, I think I would call the healthcare provider, let them know what's going on, and have a couple of recommendations to try, and then definitely call back and keep the healthcare provider in the loop of what's going on and how the response is and how you're evaluating if the loved one is, if the recommendation was successful. And so that there are, plan A, plan B, and plan C for things that you can look for in the future to help solve the situation.
And maybe we want to go back to that slide. I think you guys had the Alzheimer's helpline. That's a 24/7 helpline that might also be able to call and help de-escalate situations.
Yeah.
We have a question about suggestions when you have no help at home and the spouse has recently lost the ability to walk or move unaided. How safe is it to have a new aide come into the home with this COVID-19 and stay-at-home order in place?
Well, I think I was just going to address kind of the second part of the question, having a new person come into the home. Again, just taking the appropriate precautions, and if they're coming from an agency, to make sure that they're screened, and that you let them know, if they feel at all sick at all, they should not be coming in, and open lines of communication with them and their healthcare provider, and so that's what I would say for if you're wanting to hire a new person to come into the home, to make sure that they're screened appropriately.
And what do you mean when you say screening? Are you asking them if they feel sick? Are you asking them if they have a fever?
Yeah, so if they have a cough, if they're feeling feverish, if they recently traveled, if they're concerned about coming into contact with someone who possibly have had symptoms of flu, anything like that can put you or your loved one at risk.
I think too, it sounds like just the care needs of that person has changed a lot. So probably for the caregiver, they're undergoing a lot of changes now too, of dealing with somebody who's not able to get out of bed and can't move around as much. And so there's a lot of learning needs in that kind of a situation, of learning how to care for somebody who's more bed bound, and to help them with their daily sort of personal hygiene and such. And so there's also lots of videos available through some of the different national organizations like the Alzheimer's Association and the Family Caregiver Alliance that help sort of teach people some of the strategies and some of the actual mechanical tasks of how do you reposition somebody in bed, and how do you position them safely while they eat, things like that. Because it sounds like in this case, the caregiver is having to learn sort of a new level of caregiving tasks too.
And I was also going to add for the aide to educate them and kind of give them resources on cleaning, washing their hands, using hand sanitizer, with before care and after care, so that that's part of the routine.
And I wonder if this is a new, change, if they might be able to get a home health referral from the person's doctor or provider if they had any kind of dramatic change in their function.
I think that would be a definite possibility, and I would hope that the caregiver that's experiencing this, or other caregivers, are in touch with their loved one's primary care provider or the physician that's helping them with all of these sorts of decisions, because I think a referral for home care might be really appropriate. And if you got the referral for home care, often that means that a nurse can come out and help assess. You might be able to hire aides, even maybe a short-time physical therapist. It's all possible to sort of help you with learning how to do transfers and things like that. And if there's any equipment that would help you during this time. And it again, going back to the idea of the backup plan, these are all strategies to help you kind of keep caring for this person at home, even though their caregiving needs sounds like they're really shifting.
And I wonder if you can talk a little bit about, you referred to the personal wellness plan, and I wonder if you have any specific examples in mind where there was a particular piece of information that a caregiver shared I'm thinking of one person I knew who had orthostatic hypotension, and his wife had really specific, you know, signs that she knew that signaled that he would fall, for example. So I wonder if you have any examples of the kinds of information that's really helpful to be able to share with people who sometimes I think you have to be pretty specific to help.
Yeah, and I think when we develop the personal wellness plan, or any sort of a care plan, the whole idea is that if you weren't there to provide the care, how would people sort of provide the care in the way that's best for that person? So it is really kind of a roadmap, and I think that the example you gave is a really great one. I've had caregivers use it for things like how best to get the person to take their medication. Maybe they always take it at a certain time of day in a certain kind of a cup with a certain kind of juice. And that's all information that really helps you in transitioning to a different caregiver or to care in a facility. So I've seen the personal wellness plan or a care plan used mostly when people are transitioning in care, because it's really going to help smooth the transition. So here are the activities that the person likes. Here's the stories that they like to tell. So if this person's getting upset or impatient, if you ask them about such and such, it often is very diverting and they love to tell this story. So it's all those things that you've learned about this person as their caregiver that you know so well, and you're sort of imparting that onto the next team, the next people that might be helping you with the care. So I think it comes in really handy in terms of best ways to communicate, what sorts of things are diverting and enjoyable for the person, what are the ways that you prevent some of the negative behaviors. So if there's certain things that always trigger the person's aggression or frustration, and you really want to list what those triggers are so that your caregiver that's going to be helping really knows what triggers to avoid.
Thank you. And also for those who may not have completed an advanced directive or maybe they're not sure, or they haven't completed advanced directive and they the person with dementia is no longer able to talk or really communicate who they would want to be their decision maker. What are your thoughts for people in that situation?
Yeah, we wanted to really recognize and acknowledge that not all of us have done advanced directives, and sometimes these things come up under periods of duress like the one that we're in, and so we just really wanted people not to panic if you don't have one, and that there are still ways to get those wishes written down. As Nat said, you can take a plain piece of paper and kind of write down, is this person, you're the person that knows your loved one very well, and you probably have a sense of what their values and ideas are. And ideally they've picked you as their agent to make decisions for them. So it's really about communicating what those wishes are. And there are templates and forms to help guide that. They don't have to be signed, and which is, I think, especially important to remember during this time if you have trouble getting out to places where you normally go and get a signature or a witness. Even sort of recording conversations with other family members about what the sort of care issues that you'd want, the care decisions that you want for your loved one, can be really helpful and kind of unifying for people, so that people aren't kind of in the dark, that you all kind of agree on what sort of the future plan around care and medical decision making is. Yeah. Did you want to add something to that?
Yeah, I was going to say, I think this topic can be very big, and there are a lot of situations that we can't always think of or predict. And so going to resources like Prepare for Your Care that walk you through certain situations, certain scenarios, just conversation starters for you to start thinking about, what if this happened, what would my loved one want? Would I be able to execute this plan? And with every advanced directive, there's always a little bit of flexibility, and it's within your right, because like Jennifer said, you know your loved one the best, and you know what they would want for their health and for their care. And so allowing yourself that flexibility and that understanding of that even though we've written this down, this can always be updated, one, and two, can change, especially during this time. And if you started the Advanced Care Directive, before many years ago, and you're updating it now, things can change. And I think, like Jennifer said, you don't have to get it signed. The important thing is that you have had this conversation and you have had this conversation with the rest of your family. So everyone is on the same page, so that if there is something, an emergency does occur, you are presumably the healthcare agent. And so other family members are agreeing with you and understand that you are kind of leading the show, and you are the person that their loved one has decided to be the decision maker. So that can reduce the amount of distress for you and your family if there are a lot of people involved and a lot of family members involved.
And we've had families that, can't remember whether they've ever done an advance directive or not. And so, which I think is a really legitimate sort of question or concern. And so the first step might be to contact the provider and say, ask if those have been completed, and do they have a record of them? And if not, look around the house. And if you can't find one, you can go and use those tools that we've given you. And you don't have to use the template. It can just be having a conversation with other family members. But it's okay to go ahead and do one now. So because you haven't done one today doesn't mean that you can't do one moving forward.
Yeah.
And I think a lot of times what we hear from families is that it gives them a lot of peace of mind knowing that they've shared the plan with somebody else. And if you get sick, there'll be somebody else that will kind of help be true to the ideals and the decisions that you've made.
Yeah, definitely share that plan with your healthcare provider, who could also be a good advocate for you in certain situations, as well as, like I said, with the rest of your family, so that everyone has that document and everyone can know kind of what the plan is, and kind of who's the primary and who's secondary, if that's a situation for you as well.
And for those caregivers who are older themselves or who have their own chronic conditions and, might be more worried about their own risks and their health, I've seen a lot of different things on social media, for example, about taking these supplements or doing this to kind of protect yourself from coronavirus. Are there any known treatments or recommendations for people, as far as we know, in terms of reducing their risk for getting the disease, aside from the social or physical distancing and washing your hands and avoiding contact?
I think right now there's a lot of research going on in terms of looking for treatments and preventative measures like developing vaccines. There's nothing that we know of at this time that's been confirmed to have change your risk for being, contracting it or being having COVID. So there's no known supplement, there's no medication that we know of that would, is FDA approved or is out in the market, or that doctors and our healthcare providers are recommending to their patients at this time. So we're really relying on kind of public health measures. So the physical distancing and just basic hand washing, and making sure that you are taking precautions for yourself in terms of, taking care of your own chronic health care conditions. So making sure your blood pressure is well managed, your diabetes is well managed, so that your risk is not much higher than it needs to be.
And I think too, I think it'd be good to just bring up too is that we've seen families put a lot of stock in supplements and sort of therapies that maybe haven't been proven. We've had families spend a lot of money on agents that they, out of a really a desire and a hope, for improvement. And so I think that would be the other thing that I think we should caution people about, is just to be wary and to be careful about things that you're trying, how much money you might be spending on things that really haven't been scientifically proven.
Mm-hmm.
So this was a really informative talk. There aren't a lot of questions. I wonder, we've already kind of addressed a lot of the questions that are here. I wonder if we can just kind of go through a brief summary of what the recommendations were. So I can kind of go from memory, and you guys can verify. I think you said, you know, think about who your backup person is and whether it's documented, and that might be a friend or family member. It could be a neighbor. You know, we want people to think kind of not necessarily outside the box if those people aren't easily accessible, in terms of who they might rely on to be their backup, and then to communicate with that person and prepare information, having the information gathered that they would need to take over if needed is.
Yeah, I think it's thinking about who could take over if you weren't able, or if you were, you know, mildly sick and couldn't carry out all of your caregiving duties, who could maybe sort of pitch hit and kind of help you. And then what is it that you need? It's the who and the what. Who might help you? And then what do you need to make those transitions really smooth? And we've had people that have helped assume care, and or maybe would like to be a backup person, and part of the fear that they have is that they're not really sure what's expected of them, or they're not really sure how are they going to safely manage that person who has the cognitive impairment or the dementia. So I think as much information as you can provide to people that might help you or assume care, the smoother the transition will be.
And for people who you know, feel more comfortable paying someone like a professional, if they want a professional to be their backup, who would that be? Where would they look for someone like that?
Well, if you were going to hire like a home care aide, you'd go through a home care agency, and again, you could use the Community Resource Finder on the Alzheimer's Association webpage to look for home care agencies in your area. That might be the best way to go through an agency, because you know that people have had background checks and are screened, you know, by the agency, by their employer. There's also sometimes people rely on case managers, which are often have a social work background, and they might help in organizing the care and sort of thinking about what your needs are, and help identify resources sort of on your behalf.
Yeah. Thank you. And what were the items aside from what their care needs are? I think you had some documents that you would want copies of, like the advanced directive, the insurance cards.
Insurance cards,
Identifications.
the names and of all the different providers, and their specialty and their contact information. The names of people that know the person well and that could be part of the backup plan. A list of current medications. I think we all know from practice that people's medication lists can change a lot. So it is kind of a moving target. And if you've always relied on sort of what the pill boxes are telling you, why don't you write it down, the name of the drug and the exact dosage and the dosing schedule, so it's all in one place, so there aren't any questions from somebody about what the actual dosage is supposed to be for the different medications.
Great. Well, and for all the resources that you included in your presentation, those will be on the website as well as the presentation. Was there anything else any other tips or thoughts you want to share before we wrap up? I don't see any additional questions at this point. So,
no, I think we'll have the slides with all the different resources. And again, those aren't the only resources. Those are just to give you a suggestion of resources that you might be able to call on during these times. We'll have an example of the personal wellness plan. We'll have a checklist that you might use where you could list doctors' names, healthcare providers' names, medication lists, things like that. We'll have an example of one. But again, you don't need that. You can just write it yourself. But if you prefer to use a form, we'll have some of those on the website for you. And then, yeah, we just love to hear from people about what they're doing specifically to help during these times, and what sort of strategies they've used. So feel free to reach out to us, and keep us posted on how things are going. And again, we'll have next week, for the next 5-6 weeks, I think we're going to add a couple more topics. We'll have other topics that hopefully would be helpful for you around finding resources, maintaining your own health, things like that.
We did have one question. Does anyone have advice on a medical alert system for someone who will most likely remove a bracelet, necklace, etc.? This is someone who wanders. So I guess my question would be, does this person carry anything with them, like a wallet?
Yeah, it comes up a lot. I think, so sometimes there's some tricks. Sometimes you can secure a safe return bracelet in a way that is hard to get it off. Sometimes family members will get their own medical alert bracelet, and then it's you're not just having your loved one wear a bracelet, but you're also wearing one too, which can sort of relieve some of the anxiety for people about wearing a bracelet. So those would be some of the tricks. There's different GPS strategies
Devices.
now that are available and devices, which I think we can go into in a subsequent webinar in more detail about that. But I think also the organizations like the Alzheimer's Association probably has a list and some suggestions for those sorts of devices as well. And I would also use our own Memory and Aging Center website as a resource. We're trying to keep a lot of these resources and ideas and strategies on our website available to everybody.
Yeah, the Alzheimer's Helpline, I'll just put another plug in for them. That's 1-800-272-3900. That's free. They have trained staff who are available 24/7 to help with these kinds of questions. And, you know, there are strategies, I think, also just, you know, letting the local police department know that someone has dementia and giving them their photo, and that they're at risk for wandering, and depending on the neighborhood, if you feel like it's safe to tell the neighbors to keep an eye out, that, you know, I would recommend calling and brainstorming. And I've also, someone commented that medical alert bracelets are also actually really hard to get off. It has a specific clasp that's difficult, and sometimes people can put these on their ankles as well, although they're not as visible. So
and there's a couple other, I mean, some people won't leave the house if they don't have their shoes. So some women are really tied to not leaving the house without their purse, at the risk of that sounding kind of sexist. But so if you can hide the shoes or hide the purse, that might help deflect that person's attention from walking out the door. Certainly keeping things locked is another thing, and another strategy. And then paying attention each day to what kind of clothes the person is wearing, and if there's like if you can lean on having them wear bright clothes so that they're easier to spot if they do walk out of the house. Those are all other ideas. And on our Memory and Aging Center website, we do have a whole section devoted to tips to help prevent problems with wandering. So you could always look there for some other ideas too.
And our website is memory.ucsf.edu. That's where you can find a lot of information. And if you want to find the recordings of these webinars, that'll be at memory.ucsf.edu/COVID, COVID. And with that, thank you everyone for joining us, and we hope you'll be able to join us next week, where we'll be talking more about in-home activities while sheltering in place. And be safe and be well. We hope that nobody actually ends up having to activate a backup plan, and that we all get through this together. So thanks again.
Thank you.